SRM Institute of Science and Technology. Learn, leap, and lead.
Good morning, everyone. Wish you all a very happy Saturday. We launch our webinar on future career conversations today. We will discuss dentistry and the careers that it can spawn. The webinar is jointly being hosted by the Hindu and SRM Institute of Science and Technology. This is the fourth in the series of webinars on future career conversations. We have with us a distinguished panel of speakers, which includes two ENT surgeons, a medical cardiologist, and a thoracic surgeon. This probably gives you a wide range of topics that will be discussed. And the topic for today is tomorrow's doctors and dentists, skills that shape the future of healthcare. We have with us Professor Dr. Nitin M. Nagarkar, a former director of the All India Institute of Medical Sciences, Raipur, and who is now Dean Medical cum Pro Vice Chancellor in charge of SRM Institute of Science and Technology, Kattankulattur. This is near Chennai. Dr. Nagarkar has completed his MBBS degree with honors from Patna Medical College Hospital in 1980 and an MS in ENT from the Postgraduate Institute of Medical Education and Research, PGIMER, Chandigarh, and has obtained a DNB in ENT from the National Board of Examinations, New Delhi in 1992 and 1993 respectively. He has over 3 decades of experience in his profession and is a recipient of the Doctorate of Science, honoris causa, from Amity University in 2023. He has served as founder director of AIIMS Raipur from 2012 to 2023 and has held additional charge of AIIMS Bhopal. He is an expert in ENT, head and neck surgery, with a focus on oncosurgery. Dr. Nagarkar has authored more than 140 scholarly articles on various aspects of ENT and oncosurgery in national and international journals. He has authored 2 books, Rhinosporidiosis and Atlas of Head and Neck and Skull-Based Surgery, and has contributed 6 book chapters. He holds 3 patents and 1 copyright. He's contributed to his academic profession, to academics and professional expertise in over 100 national and international conferences. He is as the director and chairperson, resource person. Dr. Nagarkar has served as a member of the Academic Council of Indira Gandhi National Open University in New Delhi between December 2013 and 2015. He was a member of the expert group of research at IIM Raipur, as well as a member of the court of Guru Ghasiya Das Vishwavidyalaya Central University in Bilaspur, Chhattisgarh. He was nominated by the Ministry of Human Resource Development from January 2014 to 2017. He was a member of various committees to set up new aims by the Government of India. Dr. Nagarkar has been honored with Distinguished Service Award by the Delhi Medical Association in 2006, the Times of India Icons of Health Award in July 2016 and 17, and the Certificate of Appreciation from the Government of Chhattisgarh on the occasion of Republic Day 2021 for overall commendable work in the prevention of COVID-19 infection during the pandemic. The Chief Minister of Chhattisgarh presented him with the Distinguished Service Award for overall commendable work done in the healthcare services in 2023. He's an examiner for various universities for MBBS, MS, DNB, and PhD. I forgot to introduce myself. I am Sujata. I was formerly deputy editor in the Hindu. I've covered health and higher education. Welcome, Dr. Nagarkar. And he would be giving you an overall view of what exactly the medical profession is like today and how it's going to pan out in the coming years. To you, Dr. Nagarkar.
Thank you very much, Sujata Madam, for the kind and very elaborate introduction. Thank you so much. And thank you very much to the Hindu group for organizing this wonderful discussion on tomorrow's doctors and dentists, skills that shape the future of healthcare. So I think we've got a very elite panel over here with Dr. Muralidharan, Dr. Vivek Narayanan, Dr. C.S. Pramesh. So warm welcome to all of them, a wonderful panel you have organized. I'm sure that this particular discussion will be very useful for the aspiring students, their parents and guardians, academicians, and everybody, I think, whoever in our country is now looking towards, whatever are the changes occurring in education. So there's no doubt about it that the medical career or in related specialities has been one of the choices of these students for a long period of time. In fact, since time immemorial, we all know that the medical field is one of the most noble professions, like the teaching profession has been. And similarly, I think the students in the past, I think about 20, 30 years ago, their straight with the choices used to be between medical or engineering. In today's world, of course, there are so many other new courses which are available, but yet I think the medical field retains its position as one of the most important professions which students usually like to choose. The doctors which are trained in India, we follow it was originally the British colonial system, but of course there are a lot of modifications now, first by the Medical Council of India, and then of course the erstwhile that was the Medical Council of India, now we have the National Medical Commission. So they have made changes in the curriculum. For the undergraduate, you have the MBBS, and then subsequently for the postgraduate, you have the MD/MS degrees in various specialities. And somebody who is even more interested, they can go into various super specialities, which we are known as the DM and MCH courses. There are certain other programs which are known as fellowships, where somebody is interested in a particular field in the medical or surgical specialty, they can also do that. So it's a very wide career which is open. Regarding dental, I'm sure Dr. Vivek Narayan will tell more elaborately about that. As far as the medical is concerned, it's a 4.5-year course, the undergraduation with 1 year of internship. There are various subjects that they have to study, initially known as the preclinical or the paraclinical and the clinical subjects, but it's a continuum of the course which happens. And even if it's a challenging course, it's a very interesting course nonetheless, very practical. And the National Medical Commission has made a lot of changes, making it competency-based, because this profession requires the highest level of competence, and a certain degree of competence and skill should be in all the graduates who are going to pass out. So I think that's something which is very, very important. And this has been introduced in the curriculum and the syllabus which the medical students are taught. Yes, there are certain aspects of the knowledge which is more of a theoretical knowledge, but then there are skills which they have to learn as either as an undergraduate and then subsequent skills as postgraduate, which Dr. Muralidharan and Dr. Pramesh will definitely touch upon. But more important also are the attitudes and the soft skills which go with it, the communication skills, how the ethics are followed by the practicing doctors. They'll be dealing with the patients, their relatives, they'll be dealing with the public. So wide range of activities they will be learning during this course. It is a very intense course, but nonetheless one kind which is very fulfilling. Even during the course of the studies, they will enjoy the course, but subsequently when they join either as a doctor, they can join as a medical officer or take a post-graduation. That time also they can choose a very fulfilling career for themselves. Technology has made a lot of difference in our field, as it has made in, I think, almost every walk of life. But in the last few years, we can see that information technology is available, which is being utilized in diagnosing diseases, in treating diseases, in operating conditions, which are now possible, which was maybe not possible many years ago. New medications are available to treat cancers. Robotic surgery is available. But more importantly, the basic skills which are required remain as important as ever. We also have the simulation-based learning. Like, for the pilots, you have the simulation, they learn in simulators. Similarly, doctors, whether it's the very basic skills to the advanced skills, they can practice these skills in the simulators in the simulation labs and centers, and subsequently they can apply it in the real life scenarios under supervision. They are trained by the seniors, and then subsequently they can do it in real life situations. So it's a continuum, a very gradual process. It's lengthy as compared to so many other professions, because it takes many years of making to become a good doctor. But a good doctor does not only mean the technical skills. There are other aspects also. Technology will make an impact, but the human touch, the doctor's presence, the healing touch of the doctor is always going to be there. It's something very, very important. In terms of the medical education part also, information technology has made a lot of difference. I think all of us know during COVID times, many of these information technology platforms were put to good use. And these were actually existing, but now they have been refined further. So even medical education also benefits from that, like so many other courses are also benefiting. But the one-to-one, teacher teaching the student the skills, or when a surgery being conducted, the student listening to the senior surgeon, observing him in the operation theater, that all those skills are going to be still very, very important. So while we embrace technology, there are so many things of the past also which are also going to be important. But as a changing society, we need to adapt. And one important aspect where doctors will have great role is the community outreach. They will have to reach out to the community. It's not just a curative aspect, but the preventive and promotive aspects also, which will be very important. And doctors as researchers also have a great future, clinician researchers. So they are actually going to develop new technologies, new patents, new medicines, new surgical approaches, which can then be useful to society. So I think now I can stop. There are many of my panelists here. They would, I'm surely like to, they would sure add many things from their side.
Thank you, Dr. Nagarkar. That was quite an interesting overview. We knew quite a bit about how to get into medicine, how to complete the program, but the issue of adoption of technology and community outreach and research, which is now becoming more and more important now that there is the interdisciplinary, multidisciplinary approach where you have engineers and doctors collaborating. Sometimes even communities come up with some interesting ideas.
True.
That was a very interesting overview. I request Dr. Vivek Narayanan to please take over from here. And I'll just introduce Dr. Vivek Narayanan to you. Dr. Vivek Narayanan is a consulting maxillofacial surgeon who has completed BDS from Annamalai University in 1993 and MDS in oral and maxillofacial surgery also from Annamalai University in 1997. He did his FDS RCS from England in 2023 and is currently Dean, Professor and Head of Department of Oral and Maxillofacial Surgery at SRM Katankulathur Dental College. This is a position he has held since 2014. He has 28 years of teaching experience and has participated in scientific deliberations and has delivered keynote and guest lectures, besides having made 200 presentations. Dr. Vivek has conducted 8 hands-on workshops and has over 75 publications to his credit. He was the recipient of the Colgate-Palmolive Scholarship for 4 years of BDS and won the Colgate-Palmolive Gold Medal for securing the first rank in, and besides the R. Venkatraman, former President of India, Gold Medal for securing the first class in BDS. He has to, and I understand that in Annamalai University, first class is 70%. So generally, it's only 60%. He has to his credit the LPK Ramanathan Chettiar Endowment Prize for the Best Outgoing Student, the Rangaswamy Pillai Endowment Prize for Distinction in MDS, Basic Sciences, and the Best Outgoing Student in BDS and MDS. The Tamil Nadu Dr. MGR Medical University conferred on him the Best Teacher Award in 2012, and he is the recipient of the Distinguished Alumni Award from Annamalai University in 2022. He started out as a lecturer in the Department of Oral and Maxillofacial Surgery at the Meenakshi Ammal Dental College and Hospital in Chennai and became its reader in 2000. He rose to become the professor in 2005, and in 2009 he became a professor in the Department of Oral and Maxillofacial Surgery at Rajamutaya Dental College and Hospital, Annamalai University in 2009. A year later, he took charge as Vice Principal, Professor and Head of the Department of Oral and Maxillofacial Surgery at Priyadarshini Dental College and Hospital in Tiruvallur, where in 2012 he was appointed as a principal as well. He joined SRM Katankulattur Dental College in 2014 as Dean, Professor and Head of Department of Oral and Maxillofacial Surgery. To you, Dr. Vivek Narayanan.
Greetings. Good noon. Thank you very much for the kind words of introduction. Thank you, Dr. Nitin sir, for the wonderful update on the medical course. Here I am to talk about dentistry. Always medical and dentistry, MBBS and BDS, as you all know, are exams which are conducted together as of now with the NEET. And NEET, since 2016, the entrance is common to get into the course of dentistry. Dentistry is a 5-year program where 4 years of training happens with examinations, and it covers 21 subjects in all. And the 21 subjects, for the information of the aspirants, you have to understand that 8 of these subjects are taught in the medical college. So what happens generally is a person who wants to do MBBS, everybody wants to become a doctor, and having a prefix as a doctor sounds good. I think at the end of the day, you feel good about it. And that's what we all sought for when we had our own passion to do a particular course. But what happens, majority of them do not succeed in getting MBBS, and they say, okay, we'll do dentistry. So most of the students who join dentistry are not by pure dental choice, but are by default becoming a dental surgeon. This is the truth. I mean, all of us have to accept this point. But so what happens? Okay, they've chosen the course in dentistry. So it is not that you're cut off from the world of medical field. The point that I like to reiterate at this point is dentistry is an equivalent course to MBBS, and that is why there's a common exam. It's just that we are 6 months shorter than them by training, but maybe with the new education policy coming in, we're going to be at par very soon. So it will also be a 5.5-year program. Now, what is very, very important is that dentistry is given so much importance in the human body that it is a direct specialization of one part of the human body, whereas all other organs, with due respects to the professional colleagues who are other specialties in this panel, all other organs in the human body have to be specialized only after you complete your medical graduation. So dentistry is given that much importance. So I don't see any reason why one person should not opt to become a dental surgeon. This is one point which I would like to convey, because I'm sure this confusion is there in the minds of many youngsters and parents, and, oh, should I put my daughter or son into the dental course? But one thing I have to tell you, it's a very demanding course. Many people think, oh, well, let's do dentistry. No, dentistry is extremely demanding. We are working in an area of 35 to 45 millimeters of opening. And in this opening, we have to take our devices, gadgets, high-speed equipments, use so many materials, 2 hands with few fingers go in. We have assistants with another 2 hands and a few fingers. We have to hold so many things. And it's a very intense program. We do a lot of good training. We do a lot of simulation training in the first year and second year. We mimic the mouth scenario for the students and train them in models wherein they train themselves with the hand-eye coordination. The success in medical profession, being a surgeon, being a dental surgeon, is the hand-eye coordination, is the presence of mind as to what we do at that point in time. There are 9 specialties to dentistry. People wonder, what do we study for 5 years? We study almost 8 subjects in the medical school and about 13 subjects in dentistry. Apart from that, we have 9 specialties in dentistry, which all offer postgraduate programs of 3 years. And 3 years of postgraduate program exclusive. For example, if I can say gingival disease, which means the gums and its related structures, gums, the ligaments and the bones surrounding a tooth, 3-year specialized program. Replacement of teeth, 3-year specialized program. Saving a tooth, 3-year specialized program. Like this, my specialty is maxillofacial. We do big surgeries. We do surgeries of the entire face. So the training is quite intense and the course is very demanding as well. Many people try to compare MBBS and BDS. Every specialty or degree has its own uniqueness. We can't compare one to one, I think, here. So that is also one important point that I would wanted to stress upon. And linking with MBBS, as I told you, we study a lot of medical things. I would just say this is an age-old saying: the oral cavity, that is the mouth, is the window or the mirror of the human body. Whenever you go to a general physician, the first thing the physician will tell you, open your mouth. He puts a torch into the mouth and says, pull your tongue out. Very common. That is why the index to the whole human body is there in the mouth. A lot of diseases can be diagnosed by looking at the mouth. So that is the importance given. And there are all the diseases, most of the diseases that happen in the human body can be manifested by way of some lesions or appearances which we see in the mouth. There is a big link. We have a cardiologist in our panel. There is a big link from the mouth and the heart. People who have a very poor oral hygiene are highly at risk for a heart attack or a myocardial infarction. It is documented evidence. Supposing there is a valve replaced patient and there is an oral infection, they are at high risk for a very life-threatening disease of the heart. Like this, if you have a sepsis or an infection in the mouth, if somebody is undergoing a cataract surgery, first an oral clearance has to be obtained. If a mouth infection has to be eliminated. If somebody is undergoing a transplant surgery, for example, they're replacing their knee joint or a hip joint, which is very common today, or even an organ is being transplanted, an oral clearance is important. So my point here, I would like to conclude just to summarize, to say that please don't feel inferior that you're going to take a course in dentistry. Dentistry is also a very demanding program, and dentistry, I'm saying don't compare it with any profession. Each profession has its own uniqueness, and the challenges that each course may pose may be different. Scope is very good. If there are questions later, I will talk about all that later on as the panel discussion goes. But my summary is, we are not superfluous. As per WHO, we need to have 1 in 7,500, one dentist to 7,500 in our country. We are even now at 1 to 10,000. So it is not that there are too many dental clinics and too many dental surgeons. Still, we are in demand. So there is a necessity in this country, irrespective of the number of colleges, irrespective of the number of dental surgeons who are practicing. With these few words, all the best to all the students and aspirants, and pursue whatever you want to do with passion and dedication and compassion. All these things will have to go together. And lastly, have some empathy on the profession that you are going to take, empathy on the patients that we are going to deal with. We are dealing with human beings and not objects. Thank you very much.
Thank you. Thank you, Dr. Vivek. That was interesting. Yesterday we had this discussion and you said that one dentist looks at 100 patients. Do you think that it's possible? And that there are lots more dentists in cities than in rural areas. Some of it was a revelation to me. You said 8 subjects of 21 are from the medical colleges that you study, and there are 9 specializations. And the other thing you said was 35 millimeters of space you have to actually, and now I'm thinking how difficult it is to keep your mouth open when the doctor has to look into your mouth and check for whether you need root canal treatment. I've had this experience, so I know how it is. Thank you so much, sir. Next, we have on our panel Professor T.R. Muralidharan, who is a cardiologist. He's an intervention cardiologist and an electrophysiologist. He's the Director of Cardiac Sciences at SRM Global Hospital, SRM University. He is the President of Cardiological Society of India, Chennai chapter. He has to his credit 49 publications in index journals. He's organized 3 international, 5 national and 2 state level conferences. He has received FICCI Best Innovator Award under the Government of India's Department of Science and Technology and the University of Colorado, Texas. He was the principal investigator, co-investigator in 7 multinational trials. The government of Tamil Nadu honored him with the Best Doctor Award in 2011. He has delivered over 350 lectures at national and international levels. Over to you, Dr. Muralidharan. Sir, I think you're muted. Please.
Am I audible now?
Yes, yes, sir.
Thank you, Sujata, for your kind words and introduction. Special thanks to our Dean and Pro Vice Chancellor, Dr. Nitin Nagarkar, and my co-panelists, Dr. Vivek and Dr. Pramesh. I'm a cardiologist. Who has graduated in 1980s as an undergraduate. I did my MD completed in 1991, and now I did my DM in 1995. The reason why I'm telling this is the topic is going to be future, what is needed, skills for the future doctors, are how we are going to see the future. There's a sea of change that we have seen in the last several years, 4 decades. Looking myself as a student, looking myself as a teacher, and looking my colleagues here and the future students who may be attending or their parents, how the future of medicine is going to be. Few things remain standard, unchallenged over centuries, is like what Thiruvalur said, Noi Nadi, Noi Mudal Nadi, Adu Tanikkum Vai Nadi, Vaipachel. All it said was, look at the disease, identify the root cause, find out the right treatment, see to that is available or given to the patient. That is one way of looking at it. Coming back to some other things like a father of medicine, William Astor said, don't treat the disease, but rather treat the patient. I would like to fondly remember my teacher, Professor N. Sivarajan, cardiologist, who said, not even don't treat the patient, treat the person. So that is, with this background, we'll go forward. So today medicine is totally different. For example, in 1990s, a person comes to a heart attack, doing an angiogram is considered as a wrong thing, not indicated. Today, I want to do angioplasty within the first hour, proven technology. So what I learned in 90s has changed in the next 2 decades. So for a doctor today to come in, you have to know what to learn and be prepared to unlearn and relearn. That is what's going to be the future. Because the whole technology is changing. The digital AI has come in a very big way. Today, we know how the artificial intelligence is influencing us in every bit of our life. Even the talks we are giving, the phone we are using, everywhere the artificial intelligence. And same thing happened to medicine also. So a doctor of future should have a proficiency in telemedicine, in digital health tools. You should know what are the AI-driven diagnostics. To understand our days, 2-3 decades ago, we have to go to the library to look at the journal, to learn what is new. Sometimes the journal will be few months old, but today is not like that. What is happening in one corner of the world is straight away known to us. That means the AI has helped us. You have a lot of information. You don't have to spend your time in library. Rather, the library is in your hands. If you know how to use your mobile phone or your laptop or your iPads, that's one way. So that saves a lot of time. Like Astor, again, the same father of medicine said, medicine is learned in the bedside, not in a classroom or the library. Today, the classroom and library is there with the student, but we have to know how to use it. There's so much information going to come. You should understand the data. Like Eliot once said, for data, you have to know from data to knowledge to wisdom. The reverse is, where is the wisdom that is lost in the knowledge and where is the knowledge that is lost in the data? What it means is, we should know how to use the available information with artificial intelligence information highway. So the future doctor is going to have a lot of time to spend in the bedside, but with so much of data, you should know how to use it. Number 2, the data analysis paved another big way, that is genomic medicine. No longer we are just treating the patient at the bedside, but with the genetic analysis. We know today we can predict in the coming days, the whole genome sequence being available, we are going to learn more and more how to look at it, how to predict a disease, how to know the prognosis, how to treat it. So the future doctor is going to be influenced with all this information. They have to develop the skill. But the question is, with the knowledge, can I cure the patient? With the wisdom, no. You need to improve your skills. Today, as a cardiologist, as an electrophysiologist, we do treat arrhythmias. The days are not seen in the the next few decades also, where it will be replaced by a robotic doctor. You have to learn how to use your instruments, how to use your cath lab, how to do your EP lab, how to identify arrhythmia, how your hands are going to be. So the bedside manners, the skills, how to treat patients are going to be a paramount importance. That is going to be a second thing. So one side you have a lot of information, other side the skills that you are going to learn from your teachers, the skills you are going to employ on your patient, of course, with a lot of important points, how you are going to do that. That is where the emotional intelligence comes. You should have empathy. Like Dr. Vivek rightly said, you have to have empathy and patient-centered communication. Be prepared. Already we have been doing it. The future is going to be not you decide the treatment, give to the patient, rather the shared decision making. We are going to empower the knowledge to the patient and the family. Be prepared to make them to understand the disease, the various treatment options we have to treat with a lot of empathy. Lot of cultural influence also going to be there. So these are important things when we do that. So a critical thinking is necessary and ethical decision making is necessary. Ethical decision making in the sense that is going to be of paramount importance. We are not doing experience to our patient. Our aim is to make the patient to live comfortable, live longer within the ethical guidelines. So you have knowledge, you are going to develop skills, but you have to apply the ethics, you have to have the empathy, compassion. And other thing is there should be a lot of interdisciplinary collaboration going to come in this work. No more one doctor treating his patient and sending. We are the team of doctors, multidisciplinary approach, how to use the team to be together. Today, in many of our major procedures for cardiology, like larger, complex procedure, we always do one heart team approach. There'll be a cardiologist, there'll be a cardiac surgeon, there'll be a cardiac anesthesiologist, critical care medicine, internist. Everybody will join together to discuss the patient profile, to discuss the right type of treatment, then go to the patient family, to answer them, make a shared decision making. So the team interdisciplinary work is going to be one of the paramount important things. And the other thing is, it is not going to change. As I initially said, what I learned 30 years ago, slowly I was changing. The idea of changing, knowledge is pouring in. We should be ready to have a lifelong learning and adaptability. In this, many times, some of the listeners or some of my friends saying, this is so stressful. Actually, it is not. In medicine, like after again, he said, you should not look it as a trade or a business. It's a calling. Okay, you should have a competence, definitely, commitment and compassion. But I like to put this way, you come into this profession if you love it. Because any job, every job is equally great. There's nothing superior or inferior, any profession. But when you start loving your job, that's the last day you are working. Then from that moment, you are starting enjoying. So that is very much needed. So that is why I want to stress all my thing. Medicine is exciting. The future is going to be very, very exciting. Lot of information, lot of skills going to come in. It is going to pour in. We can spend longer time with our patients. At the same time, remember, be always that you are treating a person, not an object or something. That's what I tell all my patients. So with these viewers, I thought I'll stop here. Maybe in the discussion part, we can go further. Thank you very much.
Thank you, Doctor. That was really interesting. So a lot of things I learned from my college days when I used to go to the library to pick up information, to a time when I realized that you can actually get information on phone. This is one thing that I have also seen over the years. But I also wanted to speak to you, to thank you for that tip on artificial intelligence and the tip on how to see a patient not as a patient but as a person. Often when as journalists, when we write, we just say patients. And the other thing I noticed is over a period of time, since I have covered health for 20 years, and the last 5-6 years, I have noticed, maybe even 7-8 years, we have noticed when we go for a press conference, doctors generally say it's an interdisciplinary teamwork. And this has become more pronounced in the last 3-4 years. Thank you so much for that information. That input was really very valuable. Thank you so much. Now we'll move to Dr. C.S. Pramesh. He's the director of Tata Memorial Hospital and professor and head of thoracic surgery at the Tata Memorial Center, Mumbai. He has been serving on the UICC Board of Directors since 2020. He is the convener of the National Cancer Grid, a large network of 370 plus cancer centers in India, whose mandate is to provide uniform standards of cancer care across the country. Dr. Pramesh is highly committed to efforts towards reducing inequities in cancer care and making cancer treatment accessible to all geographic regions and strata of society. He is a recipient of the Rachel Pearline Global Cancer Research Humanitarian Award from the National Cancer Institute, USA. He is a visiting professor at the Division of Cancer Studies, King's College London, the Institute of Cancer Policy, King's Health Partners London, and the National Cancer Centre Graduate School of Cancer Science and Policy, Korea. He serves on the advisory board and task forces of several national and international research organizations and granting agencies, including WHO, ASCO, ESMO, and the UICC. Excuse me. His clinical interests include management of esophageal and lung cancers and minimally invasive surgery. He is the principal investigator in several investigator-initiated research studies, including randomized trials on cancer screening, surgical techniques, neoadjuvant and adjuvant treatment of thoracic cancers. His research interests include health services research, value-based care, addressing barriers to access, and cancer policy. He has more than 300 peer-reviewed journal articles, abstracts, and book chapters on various topics, including thoracic oncology, clinical research methods, translational research, cancer policy, and health disparities. Professor Pramesh has strong interest in clinical trial designs, surgical trials, comparative effectiveness research, promoting collaborative research, health services research, and cancer policy. He is a postgraduate diplomate in clinical trials from the London School of Hygiene and Tropical Medicine, the University of London. He is keen on promoting training in clinical research methods and conducts several courses on clinical research methodology, biostatistics, and scientific writing. Over to you, Dr. Pramesh.
Thank you. Thank you very much for that kind introduction, and to the Hindu group as well as the Ramchandra Institute for this opportunity. I'll speak as on behalf of surgery, cancer, as well as thoracic surgery, because I straddle these fields. And I think my job's been made much simpler by my esteemed panelists who spoke about many of the aspects of being what it takes to be a good doctor. And I think in all these areas, whether it's surgery, medicine, dentistry, any of these areas, I think the fundamental principles of what constitutes a good doctor remain absolutely the same. It's keeping the patient, or as Dr. Muralidharan said, the person at the center of everything that we do. And surgery is no different. Conventionally speaking, surgery has always been associated with the act of operating. And it's also true that it's dramatic. If you go to a surgeon with appendicitis, one surgery is done, your disease is cured, and you never need to meet that person again. Unlike many of the other medical specialties where it goes on for a much longer time. But unfortunately in surgery, many young surgeons, especially undergraduates who choose to take surgery as a career path, equate it only to the act of operating. Nothing can be further from the truth. It is not just operating. A lot of it is actually decision-making, knowing when to operate and when not to operate. As many of my previous panelists also mentioned, it's a huge team effort. A surgeon who thinks he or she is the single most important part of a patient's treatment, of a patient's surgical treatment, is deluding themselves. Unless they have a really good team of assisting surgeons, nurses, intensive care physicians, anesthesiologists, physiotherapists, the outcomes are never as good as, regardless of what the skill of the individual surgeon might be. So one of the most important elements of being a good surgeon is being a good team player. The other part is, again, about after surgical care. Often the impression that many youngsters have is that the surgery is done and my job is over as a surgeon. Again, the post-operative care is as important, if not more important, than the actual surgical technique itself. Another thing that most surgeons will need to keep in mind is this constant need to get better at what you're doing, not just by surgical technique, but by your overall outcomes. And this is where the question of audits come in. You need to be ruthlessly honest with yourself, with your own results, what your complication rates are, benchmarking yourself against the best in the world, and making sure that you are not an outlier as far as the perioperative outcomes are concerned. I think surgical technique has changed dramatically in the last 2 or 3 decades with the increasing use of technology. We now have laparoscopy, thoracoscopy, and robotic surgery being done very routinely. And it would be foolish for a surgeon of today not to embrace these technologies. And while these are tools, they remain tools, and it's only with the skill and the knowledge of the surgeon and the expertise of the surgeon that these tools can be used optimally to make outcomes better. It's not just a profession. I think surgery is, it's truly a privilege. And I think it's true for most medical professions, but surgery is very dramatic in the sense that in no other field does the patient give himself or herself up to the skill and expertise and the knowledge of the surgical team. Which other part of life would someone allow you to cut them up, mend what is wrong in your body, and get them better again? So I think it's truly a privilege, and it's a privilege that we need to take very, very seriously. Outcomes, I'll move on to cancer now. Cancer is again an extremely challenging field where we have to live with the reality that the outcomes may not always be positive. There have been remarkable advances in the way cancer is being treated. Outcomes have got a lot better in the last 2 or 3 decades with modern advances, but yet that it's a very humbling field, because in spite of the best of your efforts, there are times when the outcomes are not very good. And therefore, you need mental fortitude as much as skills and knowledge to be able to go through a career in oncology. We also need to realize that a diagnosis of cancer puts patients at the most vulnerable part of their lives. It's not just the patient who gets affected, it's the entire family who gets affected. And holding their hands and going through the cancer journey along with them is as much a part of an oncologist's job as it is of the treatment itself. And therefore, empathy, which several of my previous panelists also emphasized, is especially important in the field of cancer. And again, unlike other fields, I gave you the example of surgery where you have a one-off interaction and that is it. Cancer is exactly the other extreme, where it's never a one-off interaction. The journey with the patient goes on practically for the rest of their lives, even if they are completely cured, 5 years, 10 years, 20 years after their cure, because the issues of survivorship, the specific problems of survivorship are some aspects that the cancer physician or surgeon should definitely know. And again, emphasizing the importance of communication. Finally, I want to talk about thoracic surgery, which is what I do for on a daily basis. At one point, maybe a decade or two before, if you asked a cardiothoracic surgeon which branch of cardiothoracic surgery they would want to devote the rest of their careers on, almost 9 in 10 would say cardiac surgery, because it was more glamorous, it was more paying. But now things have changed substantially. And given the increasing burden of thoracic illnesses, the role of a thoracic surgeon as opposed to a cardiac surgeon is getting more and more important. It's not to belittle what the cardiac surgeon is doing. It's just that every field, just as Dr. Vivek Narayan said, needs its due, and it has its own place in society and in healthcare. It is also, thoracic surgery is also one of the most complex fields amongst all the surgeries that are done. Probably along with hepatobiliary and pancreatic surgery and skull base, which are equally complex. These are some of the most complex surgeries that you do, and it's certainly not for the faint-hearted. You need to be mentally strong to be able to take long surgeries, to be able to handle complications, because these are surgeries with a substantially high complication rate. And it's a very humbling field. You're only as good as your previous surgery was. You could have had 100 surgeries with no complications, but if your 101st has a major complication, then you need to go back to the drawing board and be ruthlessly honest with yourself as to what you could have done better. And again, not to about the importance of anesthesia, nursing, ICU care, pulmonology, physiotherapy, practically every branch of medicine and paramedical sciences come into this area. The final part that I want to talk about is not specific to either surgery, cancer, or to thoracic surgery. And I think it's the importance of education and training as a physician. The moment you become a physician, as you get more and more experienced, it's our duty to ensure that the next generation of physicians are equally well trained. And your role as a teacher, as a mentor, and as an educator is something that you should look at very carefully. Research, again, is something that's extremely important. Given that we constitute 18% of the world's population, we just contribute 2% of all the medical literature in the world. I think this is a very sobering statistic and something that we need to change. Research done in the West is often not applicable to India. Therefore, contextually relevant research, which is relevant to the quality of what a physician should be, is that you just can't be just a doctor and say that's I'm a good doctor and that be the end of it. Leadership skills are extremely important, regardless of which field of medicine you are in. You could be in cardiology, dentistry, whatever field you might be in. Being a leader is an extremely important, and looking at things like health economics, policy will all become important as the years come by. Thank you very much for listening to me, and happy to take any questions.
Thank you, Dr. Pramesh. It was actually enlightening, I would say. Cancer as a word is scary, and you made it look like it is not a big deal, but you have to be careful how you work on it. And you said something that really touched my heart. You said a person who has survived cancer after surgery, even after 20 years, will come and visit the doctor, which I never thought was actually the situation. I thought once after 5 years, once they had survived, they were like out of the ambit and they could live a happy life, I thought. Obviously, I was wrong. I didn't know that. So there are a few questions here. So the first one is from Dr. Kaustavkar. He says he wants to know how to increase dental business models.
I saw the question. I didn't want to answer live, but I want to intentionally take it on by voice.
Okay.
But the moment you start taking medical profession as a business, I think whatever I spoke and whatever all my esteemed panelists also conveyed, I think we have lost the business there. So I don't want to comment on this. Thank you.
Okay, so that was quite an interesting question that came up. So I just want to put it across. Here's from someone.
You don't have to read that question. I've seen that question.
Which one, sir?
There's another dental big question is there.
I'm a pediatric dentist.
Yeah. So it's
okay,
very
sir.
She's already a practicing dental surgeon, a pediatric dental surgeon. She's cases with very severe problems with the teeth. And today's generation of children have very bad oral hygiene. So her point there is, she's saying the pediatrician is the first point of contact. Why can't the pediatricians refer their kids early on to the pediatric dental surgeon is a specialty, so that we don't see children with very grievous problems. And most of the time when you have multiple problems with children, we are subjecting them to general anesthesia and doing the procedures. So many of the parents are very apprehensive to that as well. So it can be early detection and the pediatrician's role. This is where this teamwork, we've been talking, all of the esteemed colleagues were talking. We have to collaborate. Sometimes we work independently. That's where the challenges come. That's where we miss out on certain things also in the field of medicine. So this can be taken up at a level of the pediatricians, and maybe it could be said to the pediatricians, it is mandatory that you have to refer this particular patient of yours as a child. The 2.5 years is the first visit to the dental clinic. How many in our country would do it? In India, it would never happen. In India,
so a child who is 2.5 years, when he or she is 2.5 years, they should visit the dentist.
They should be going to the dental clinic, because by then the 20 primary teeth or the milk teeth all are already come. And every 6 months, the visit to the dental surgeon is important. This is how the policy in the West is. If you don't go to your dental surgeon, who is your nominated physician dental surgeon, you will not get an appointment in the Western world. Whereas in our country, our patient will say, see, I cannot come at 8 o'clock. I can come only at 9 o'clock. That is how our country works, unfortunately. So this is how the problems are getting aggravated. And in dentistry, we see only at the end stage. Like probably even Dr. Pramesh will agree, in our country, we see most of the cancers in very end stage. So we are sometimes helpless.
Yes. So here is a question from Mr. Madhukar. He's saying we have this, there's a problem here. There is not enough doctors to the population ratio. We now have technology like artificial intelligence and robotics that is rapidly progressing. So how India should maintain a balance between manpower and technology? Would somebody elaborate? That's his question.
I think I can take this question, ma'am.
Sure, sir.
I think no doubt about it that technology has been, we've been discussing this, I think, throughout this talk, that technology is always going to come. New technology has to be embraced. We cannot be left behind. Let's go to the first point that he has mentioned. Yes, in terms of the doctor-patient population ratio, certainly the numbers of the medical professionals now are much, much more now what we were having about maybe 20 years ago. You know, the government has a focus to increase the number of undergraduate as well as the postgraduate seats. We of course have to look into the quality issues along with increasing the number of seats, which again will remain an issue, but it is being addressed nonetheless. So over a period of time, that number is going to increase, the number of doctors available will increase. Yes, maybe there is a skewed population, doctor to population ratio, like Dr. Vivek mentioned, for the dental surgeons as well. That is true for the medical professionals as well. They might be less in the remote or in the rural or tribal areas. Artificial intelligence, robotics, these are all tools which are only going to aid us, which are going to help us. The skills of the doctor or the medical, the physician or the surgeon is going to be very important. In fact, you will have to enhance your skills. You will have to be abreast with these changing technologies to provide the best to your patients. So I don't think they will outpace, but yes, like Dr. Pramesh also rightly mentioned, the doctors will have to, or the dental surgeons, whoever they would continuously have to upgrade their skills. It is also known as, depending upon what you call it, continuing medical education, continuing dental education, continuing professional development. You have to go and undergo this training, otherwise you will be left behind. What was being practiced 30 years ago as a surgical skill in our own specialty as ENT head and neck surgery has changed entirely now. And maybe 30 years down the line, it will be totally different. But the patient or the person, as we've been talking, their expectations definitely will be always there. We will have to provide the best possible use of the available technology. But since the technology gets upgraded, we will have to keep pace with it, no doubt about it.
Thank you, Dr. Nagarkar. Yes, I noticed this because I remember when my grandmother had a cataract operation, it was like 21 days. And then now it is just that you go in the morning, get it done. And of course, you have to continue the drops and all the other procedures of not washing your hair or face for 21 days. But the rest is all fine. Things have become much different now. Thank you so much for that. Now there's an anonymous attendee who's asked, how can doctors collaborate with scientists, researchers to find new drug targets and therapies? I was wondering if Dr. Pramesh would take this because you've done a lot of research work. I don't know. Anybody can try this. Who would like to speak?
I'm happy to take a first go on this and maybe
Sure, sir.
contribute.
Sure, sir.
I think the problem is not, I think the problem is not that we have inadequate numbers of scientists, researchers, or physicians to work with. It's just that all of us work in silos, and it is this interaction between scientists, physicians, and researchers which is so critical in whether. And I wouldn't reduce research to just finding new drug targets and therapies. It could be implementation of what is already known, which is called implementation research. It's qualitative research, a lot of other aspects more than just drug discovery and other therapies. So it's this creating this ecosystem where you almost create a sandbox where researchers, physicians, clinicians, scientists all work together and combine their expertise and knowledge in finding new, making new discoveries. We created a system within the National Cancer Grid of having research institutions, cancer hospitals, patient groups. And I think it's, we have a philosophy in the National Cancer Grid that there is nothing that we will do about healthcare without patients, whether it is guideline development, whether it is designing research, whether it is identifying research questions. Patients form an extremely important cohort of individuals who will contribute towards this, and it is creating this ecosystem. And I think we can each of us do it in our respective fields that will enhance this ability to collaborate. And I think again, research is an extremely important team game, and creating the right environment for these individuals to collaborate is critical.
Thank you, Dr. Pramesh. Yes, research is hard work, and it gets harder when you're actually dealing with humans, with people who it's very difficult.
Madam, I'd just like to add
Yes,
that
sir.
this is a
Yes,
very
sir.
important point raised. We do have, I'll just give an example of our own institution in SRM. We have different departments working here together, like we have been talking about multidisciplinary. We have a separate Center for Clinical Trials and Research, which is an ICMR approved phase 1 clinical trial center. So where the doctors, scientists, all of them pitch in together, and that's where all these things are tested. Of course, it's to be done along with a lot of regulatory bodies, their permissions and approvals. But certainly these things are existing in our country and in India, which has a huge patient load. What we've been talking about, if we will have to create our own data from our own clinical data set, which is available. Only then we'll be able to have guidelines and therapies focused more towards our patients. Otherwise, we'll have to listen to the Western data only. Yeah, ma'am.
Thank you, sir. So there is one question for you, Dr. Nagarkar, from a person called Himanshu Chandra. He has actually posted two questions. One is that he's a final year student of BDS, and he's recently joined a dental clinic, and he noticed that there's a huge difference between what was taught and what is being done in clinic. Now, I can tell him that this is the same thing even with journalism, but then that is a different story. And also, he wants to ask you, where can he publish his research papers?
I think I'll do the research paper publication question, and Dr. Vivek can answer the other part related to the dental field. I think, yes, I'm very happy to note that he's interested in publishing. That's the first thing we want. We want everybody to have a keen interest. Only thing what we would say is that you choose the journal properly. Number one, there are n number of journals which you call as the predatory journals. Don't go for them. There are those journals which are indexed, say under Scopus or Web of Science or PubMed. They should be proper indexed journals, the list of which is available always online. These lists are available. Please choose those journals. Choose a topic which is relevant, and you can follow the guidelines. Certainly, you will require if you are doing it for the first time, a mentor or a guide will certainly help you. But publishing research papers, whether you're in government service or private practice or in a private hospital, is something which is key. We definitely need to publish proper research papers, but follow the guidelines and publish in good journals. And the list of which is usually available. Dr. Vivek would like to answer about the dental part.
Publications in dentistry are also, equally challenging and demanding. There's no doubt about it. And we do try to do it in allied journals, but then sometimes these publishing also takes a lot of time. So that is where people generally get demoralized. That's the whole problem that we face in publication. So some of the reputed journals take about a year to publish. But one thing, research is never ending, because in the field of dentistry, there's enough scope for research. You can invent, you can patent so many things because you feel one particular small bend or curvature and an instrument is going to give you a special access to something. That's the way. The sky's the limit.
So, but the other part, sir, that he noticed a huge difference between what is being taught in classroom or in
what about the clinic part of it? Yeah.
Yes.
The clinic part of it, theoretically, we are supposed to do so many things. Practically, also, we train everything. But one thing about a medical profession, let's say it's a lifelong journey. I can't teach everything in 5 years. After 30 years also, I'm still learning. Today also, I may learn something new. Dr. Pramesh, when he's operating, he mentioned that too. 100 surgeries, the 101st surgery, he may have a complication. So we do have challenges every day. So it's a lifelong journey. You cannot master something. You are never a master of the profession. Let's take it in medicine profession or in a surgical specialty, you can never be a master. And if a surgeon does not see complications, he has not done enough.
Thank you, sir. That was hard hitting, but I would tell you that even for us, it's a learning journey throughout. And what happens is, over a period of years, as we've been as a journalist, the more we cover, the more we get the nuances of whatever the subject that we are covering is. And we don't generally tend to make repeat mistakes. That's what I guess is the truth in every profession. And so I have here one person who has said, do you think, Deepti Sharma, she says, do you think there should be a specialized soft skill trainer in medical colleges, and how important it is?
Nitin sir,
Yeah. I think so. Yeah, I will tell that.
Okay, sir.
Definitely, we've been talking about these soft skills being very important. I'll just mention that the National Medical Commission has formally introduced what is known as ATCOM, which includes attitudes, ethics, and communication skills. But that's just to mention that they have introduced. Many of the skills you see can be taught. The doctor is learning many of the things which are theoretical. The student has access through the textbooks or journals or online. But attitude is something which has to be first of all, which is innate with the person, and which he has to learn through the seniors or the mentors. So that kind of a skill has to be developed. All the time you have to understand that what are the needs of that particular patient and the relatives. Try to what we talk of empathy, try to put yourself in the foot in the shoes of that particular person, what he's passing through, what are the difficulties that they are having. And these communication skills, everything what you talk to the patient or the relatives needs to be documented. This documentation is going to be very, very important every time. And you have to give time to them. Like I think Dr. Pramesh mentioned, that when you operate a patient, that's not the only thing. You have to see the patient in the post-operative care. Suppose you go to the ICU, the patient is in the ICU, you have to come out and talk to the relatives, tell that the patient is fine. If there are issues, tell that beforehand. There's no point in telling something later on. Keep the patient or the relatives abreast. And let me tell you, even some of the very uneducated patients and public also will understand very well. Those which are educated, they might have a different set of questions. You have to adapt. Each one of them is different, but each one of them you have to consider, empathize, develop good communication skills. I'm sure that will lead to a great improvement in your own skill as a doctor. The patient will definitely remember you as a very kind-hearted doctor, whether physician or surgeon, once they see this kind of behavior in you. Yes, ma'am.
Thank you, Dr. Nagarkar. That was wonderful, actually. I really enjoyed that particular bit of what you said about empathy and how you should actually talk to the patient and document what you're talking to the patient, which is very important. Yes. So here is a person, Priyadarshini Bopar-Dikar. She says she's a wellness consultant and she's collaborating with healthcare professionals around latest AI-based innovations that are supporting healing. So she wants to have a chance to introduce this to the team of doctors. I suggest that you speak to the institution or Dr. Nagarkar separately through email.
Sure.
No, I was telling Dr. Priyadarshini, Mrs. Priyadarshini, that she could contact you, sir. Then here, nowadays we face a lot of issues with teeth in order. No much issues is because of toothpaste. Oh, I think the question is it an issue of toothpaste or lifestyle that the teeth are not in order? I'm assuming that's what they're trying to say.
He meant disorders probably,
Okay.
and it's related due to the lifestyle. That's all.
Okay.
Now, if it's the old concept of using cold powder and brick powder.
Yes.
Yeah. So, did the toothpaste bring the problem to the patient? Sorry, I beg to differ that it's only a lifestyle problem that we are facing, and all the food habits have changed dramatically in the present era. So, our dental problems are only going to increase, nothing is going to reduce.
Right. Thank you, sir. Then there is this question, will Betty, Nine and George. She says, will the advent of AI increase or decrease the demand for doctors? That's a question.
I think Dr. Muralidharan had touched this topic. He can expand more.
Yes, sir. Dr. Muralidharan?
Sir, interesting question. Yeah, interesting question. Like, will there be a computer or robotics will be treating the future human beings? That's not going to be the future. Rather, they are all going to help a lot. For example, today, as Dr. Nitin sir said, once we document, the records are there. When we follow up, in a single moment's glance, we could see what happened to the patient in the past, what I'm going to do in the future, what's happening. So, how I see artificial intelligence going to reduce the work burden to the doctor, going to make the records more and more accurate, going to improve the patient care, make us to spend longer time in giving the best care to the patient. So the quality definitely going to improve. Quantity it's not going to come down. I don't think it's going to make the doctors obsolete or other things. So it's a mixture. That's how we should read. So, people who are going to aspire to become a medical professional, don't get dismayed or don't get afraid that you will be outdated. Definitely, more and more doctors are needed to take care of the humanity, and the AI is going to come in a big way to help us when you know how to use it. Thank you.
Thank you, Doctor.
Just one word, madam.
Yes, sir.
Human touch is a healer that will never go away from the medical profession.
Yes, I agree with you then. Thank you, sir. So this is for you, Dr. Vivek Narayanan. This person is an anonymous attendee. He says he's a NEET aspirant and his only aim is to become an oral and maxillofacial surgeon. This branch excites me and makes me dig into dentistry.
Okay,
I
madam.
want to know what is the scope of oral and maxillofacial surgery she's a woman, as a female doctor.
Yeah, I don't think there is any separation between male, female today, as is in the medical profession today. If we find at least in dentistry, it's about 75-25 now. 75% are females. So automatically, when 75% of females who join an undergraduate program, so obviously we're going to find more in the postgraduate program as well. Gone are those days where maxillofacial surgery were taken only by men. Today we have leading women surgeons across the country in India, and they're all doing exceedingly well. I don't see any reason why a woman should not become a surgeon, and as long as you have the determination and the passion to do surgery, nothing can stop. No gender bias here.
Thank you, sir. So I think there is this person who is a doctor who is practicing dentistry, Dr. Guru Lingappa. He's been practicing dentistry for 4 years now in different metro cities. I always wish to do my MDS in OMF's oncology, but my seniors say that even after doing all PG course and super specialty, the amount of work allocated in OT is negligible. Kindly guide me, doctors.
I understand, ma'am. Since he wants to specialize in cancer, I will leave this question to Dr. C.S. Pramesh. Because we do have fellowships in oncology, surgical oncology, even after MDS maxillofacial, including Tata Memorial Center offers fellowships for both ENT as well as maxillofacial surgeons. Dr. Pramesh?
Yes, I agree. I think there's a lot of scope in this, and there's also a subsequent question later on in this Q&A session also about what the thought about MDS surgeons operating oncology are. I think you're as good as your surgical skill, knowledge, and expertise go. I don't think you're an MSc ENT. Provided you're well trained in cancer surgery and you're familiar with the anatomy that you're working with, your degree shouldn't actually matter. I've personally seen a number of very good maxillofacial surgeons perform extremely high quality cancer surgery. And I don't think we should be protective of our own turf and say only surgical oncologists or MCH surgical oncologists or MS dental surgeons or MSc ENT, or it's only as good as your knowledge, skills, and experience go. I wouldn't think that MDS is necessarily a hindrance to being a good surgical oncologist in maxillofacial.
Thank you, Dr. Pramesh. So we'll take one question about a student who is a class 12. He's a class 12 student. Oh, okay. He's saying, what are the typical qualities a class 12 student should have who aspires to become a successful doctor of the future? It's a very tough question, but you just learn only through experience. But anyway, would anybody, doctor, would like to take this question?
It's a very interesting question. I think everybody would have to pitch in, I think, a few viewpoints. Yes. I think they're at a very exciting stage of life. They're at the cusp of life where they can go to such a large number of professions today. As I just mentioned in my initial remarks about when we were all, I think almost all of us belong to almost a similar generation, where only medical or engineering, couple of these points were there and where you could then, go for your future. There are many, many options for them today. But as a class 12 aspirant, I would say, yes, they can definitely choose whether they would like to go for an engineering means from the math side, or they want to go to the biology side. Once they go to the biology, then they can become, not just doctors, that is MBBS, they can go to BDS, they can go to pharmacy, they can go to allied health courses, occupational therapy, physiotherapy, nursing. Almost all of these professions have immense scope. India is going to be one of the maximum producers of healthcare providers in the coming times, and they will serve not only our country, but they will also be serving other nations as well. And I hope that they, of course, can come back and serve our country again. There are different commissions which are coming up, not just for the medical, practice, but also allied health commissions. So the world is open to them. Just don't restrict to medical alone. Or as a doctor, as an MBBS doctor, I would say yes, it's up to you to choose. But there are other very good options also. You are at a very exciting stage where you have a multitude of options, including research, which we have been talking about. All those remain open to you. Yeah, thanks. Anybody can take.
So actually, we will use this as the closing remarks for because other questions are generally, they're repeating themselves in different words. So I'd like all of you to take this question as the last question. Is that okay?
I'm fine, man.
Thank you, sir.
Yeah,
who would like to take this?
class 12 student.
Yes, sir.
Yeah, so today, gone are those days of the 80s or 70s where every family had an engineer and a doctor. Today, the avenues for students are plenty. I think what they need to do is to first identify what their forte is and pursue a career in that. And today you find people get a little bit confused and carried away by looking at the outside world. And that is where you think, oh, this is more glamorous, that is more glamorous. And that is where the confusion starts in the mind. I only have a request, if there are any parents listening to this, never force your child to do something. Allow the child and guide your child to the course that they want to do. Thank you.
May I take over?
Yes, sir.
It's an interesting thing. Suddenly, as I told my initial talk, I went back to 1981 when I was a +2 student. What made me to take medicine? Like peer pressure. I was with a lot of I'm the first doctor in my family. I have a lot of my colleagues who are doctors' children, who are aspiring to become doctors. That motivated me to take it. But where I would like to stress is to my young friend, want to become a doctor. Yes, a good idea. You are loving it to become, try everything to become. Any field, as Nitin sir said, Dr. Vivek said, medicine has so many avenues, you can choose one. Number one. Number two is, it is not like a business, successful or business model. Don't go into that. There is a Tirukkural, again, I want to end with Tirukkural. Thondri pugalodu thondruga, agtilar thondali thondramai nandru. I know there are some people may not be fluent with Tamil. What it says is, you choose any profession, try to become number one in that. Give your full dedication. You are becoming a dentist, you are becoming a scientist, a biologist, doctor, give full dedication. Secondly, success is individualistic. Do we think a doctor would have very complex is successful? Same success is there for a doctor who is serving poor people in a village. So the satisfaction, personal satisfaction is going to make you successful. So over time, my dear friend, you are 12th standard, choose medical field. I'm not saying doctor, medical field, whichever suits you. Aim for the top and understand that you have a golden opportunity to serve humanity. Serve with full dedication, and success is going to be individualistic, which you will learn over years. My best wishes to you.
Dr. Pramesh, your concluding remarks.
Yeah, sure. So I think everyone's made some excellent points. My one bit of advice would be, whichever profession you choose, pick it for the right reasons. Pick it because you have a passion for it, not because it's the one which is most popular, it's the one which will make the most money, it's the one which your parents want you to do. Pick it for the right reasons, because your decision you take today will reflect on your life for the next 50 to 60 years. And while many of these that I mentioned about the glamour, the money that you'll make will last you for a few years, what you do every day, what you wake up every morning and start doing will depend on the decision you take today. And you need to go for whatever you feel is the best. If you want to be a doctor, go for it. It's a long period of training. If you want to be a subspecialist, it's close to approximately 15 years of training. If you want to even be a generalist, it's about 6 to 10 years of training. So be prepared for the long haul. Be prepared for a life where while you might strive for an ideal work-life balance, it may not always happen because of the fact that health being what it is, it doesn't obey office hours rules. You can have emergencies coming at any point of time. So be prepared for that. Go into it with your eyes open, and you will not be biased. I'm prejudiced because I've been doing this for many years now, as many of our panelists have been. But it's a true privilege to be a doctor and to take care of people's health. And that's something that is not the case with many other professions. So go for what you think is the most important thing in your life.
Thank you, Dr. Pramesh, and thank you, Dr. Nagarkar, Dr. Vivek Narayanan, and Dr. Muralidharan. This has been a very interesting panel discussion, and we are leaving the children with the idea that there are lots of things that they can do and not be pressurized by either their parents or peer, but just to look at what they want, what they think they're going to be there in their life for the next 60 years. Thank you very much. This has been a very interesting session. We have discussed a lot of different issues here, and I hope students will take it back home and act on it. Thank you very much.
Thank you. Thank you, everybody.
Thanks.
Thank you.
Thank
Thanks
you.
for the wonderful interaction. Thanks to the group. Thanks to the Hindu group.
Thank you, sir.